Tonight, if you are planning to have surgery, you may want to call ahead. A major Valley hospital chain is pulling back on elective surgeries, and others might follow as well as the coronavirus surge fills their beds. Team 12's Bram Resnick asked the state's top public health official what she's doing about it.
One way to free up hospital beds is by doing fewer elective surgeries. So it's not a surprise that Dignity Health is pulling back, especially when you consider this. A new projection shows that Arizona could run out of hospital beds in just 3 weeks. Health Services Director Dr. Kara Christ tells me she's working with other hospitals that might have to cut back.
State of Arizona is headed currently in the wrong direction.
And the state's heading there faster than ever before. In Maricopa County, 1/3 of all cases during this pandemic were reported in the last week. Statewide, coronavirus patients are filling up hospital beds. A record 86% of inpatient beds are occupied and 88% of ICU beds. And there is no end to the surge. Arizona State University modelers now project hospital beds will be full by the middle of July.
Patients in many cases are staying in the hospital for long periods of time, a week, 2 weeks, even longer. And yet there are new cases coming in. And
the Valley's 4 Dignity Health hospitals are trying to stay ahead of the surge. A spokeswoman tells 12 News St. Joseph's Hospital and St. Joseph's Westgate won't schedule new elective surgeries for 1 week, from June 27th through July 6th. Elective cases already scheduled will go ahead. Chandler Regional and Mercy Gilbert might postpone elective surgeries to hold beds for COVID patients. Emergency and urgent surgeries are not affected. State Health Services Director Dr. Kara Christ says she's working with at least 2 other hospitals to reduce their elective surgeries.
We are currently continuing to work with hospitals in Pima County, Maricopa County, some of our major systems, to make sure that they can continue to accept patients.
There's a lot at stake, not just the health of patients, but the financial health of the hospitals. Elective surgeries are moneymakers.
But we do want to make sure that they're keeping staff on board and are able to manage the capacity and manage the state's needs.
In Phoenix, Bram Resnick, 12 News.